Good morning, everybody. Welcome to another Mancoll Minute. Seems like it's been a long time since I've talked to you. I went down and did some teaching down in Texas, and I guess that makes it seem like a long time. We've been talking about body contouring, and I'm going to kind of go back and forth between different aspects of it, but I thought I'd cover today one of the topics that people, I'm not sure if they love to hate or hate to love, and that's wearing a compression garment after surgery. Compression garments are just designed to really control swelling and bruising as a result of that. And for most people, they're going to feel more comfortable with their garment on than without their garment. And they'll tell you, even at that first visit, I couldn't wait to get my garment back on after I took it off to shower. We have a company we send people to. You call them up, you get online, and they sort of walk you through measurements, and depending on the surgery you're having will dictate really the shape of the compression garment that you need to get. But as a rule, I've got my patients in compression garments for about 6 weeks. I think the first 2 weeks, maybe 2.5 weeks, are for me. And when I say for me, what I mean is I need that skin and fatty layer to sort of scar down and stick down to the muscle layer. And the rest of the time, patients are really doing it more for themselves. And if I had to say, about 90% of folks at 6 weeks, when I say, all right, time to get rid of your compression garment, get all the core muscles working 100%, their eyes get really big, and it's like, oh my gosh, I've got to get out of my garments. Yes, it's time to sort of get rid of the training wheel, so to speak, let your full core engage and not have the crutch of a compression garment to help it out so that you can kind of continue to work on, keeping your muscles strong. It may mean you have to step down from something a little less compressive for a week or so, but certainly by 8 weeks, everybody should be out of all of that. Now, with that said, doctors do things a little differently. This is my own protocol. It seems to work for my patients, and as a rule, I've been very happy with it. One final asterisk, though, on compression garments: if they're not worn properly, if they don't fit properly, you could have one of two things happen. One, you can just plain old pinch your skin and actually hurt skin. I've seen skin breakdown, I've seen blistering, I've seen full thickness skin injury. I've also seen people where their skin might fold a little bit, particularly in the middle, and then it actually leaves a crease. So it's really important for everything to be super smooth underneath. That's a really important point you hear me say over and over and over again. Nothing will take a home run liposuction case or body contouring case and just sort of make it less successful than if that skin isn't as smooth as it can be. So that's my thoughts on compression. Hope that's helpful. Any questions about it, give my office a call. See you later. Have a good week.